Hello and welcome to Pulpal Diagnoses. Today we're going to go through two background topics that are critical to understanding how to diagnose a patient's pulpal status. These include nerve fibers like the A delta and C fibers, as well as some pulp tests that are used in clinical practice. Then we'll get to the actual diagnoses. First, there are two nerve fibers that you should be familiar with to understand different kinds of pain a patient might present with. These are the A delta and the C fibers. A delta fibers are myelinated, which is why I'm drawing this tube around the nerve. C fibers, on the other hand, are not myelinated. This means that A fibers will conduct fast pain, which is sharp and brief, while C fibers, on the other hand, will conduct a slow, dull, aching pain, which is known as slow pain. Next, it's key to know where these fibers are located so that, for example, if a patient mentions a dull, aching pain, you know the inflammation has reached the C fibers. A delta fibers are going to be located in the area of the dentin-pulpal junction, that's right here, while C fibers are located throughout the pulp. Thus, if a patient is complaining of a dull pain, it's likely that they're experiencing inflammation within the pulp. Next, we want to note that A delta fibers need oxygen, while C fibers can withstand hypoxia. Before moving into pulp tests, we want to make sure that we gather enough information from the patient. You'll want to complete the following 3 steps. First, you'll need to take a medical and dental history. Next, you want to do a quick physical exam, which is going to include blood pressure, heart rate, and temperature. And finally, you'll complete a thorough interview where you ask the patient about what they've been experiencing. Many times, these pulp tests that we're about to perform are aimed at recreating these symptoms. So finally, it's time to do the pulp tests. First, you need to know about the cold, EPT, and heat tests. These are pulp sensibility tests, which assess the condition of the nerves within the pulp. So I'm drawing the snowflake here so you'll remember the cold test, and I'm going to draw a lightning bolt to symbolize the EPT test. Now these are very commonly known, but it should be noted that this is just one of 5 tests. So next we're going to look at percussion. You're going to percuss the tooth or teeth in question. This will tell you about the status of the periodontal ligament, or PDL, which I will draw here so that it's easy to remember. You'll also want to palpate the gingiva on the buccal and lingual sides of the tooth. I'll draw a pink bone so that you can remember that we're looking for inflammation or sensitivity in the gingiva and in the surrounding bone. Next thing that needs to be done is a sort of mini periodontal exam in the region in question. You'll assess probing depths and tooth mobility. Remember that pulpal inflammation can be of endodontic or periodontal origin. And finally, radiographs of the tooth in question are key to the diagnostic process. Now we can really begin to discuss pulpal diagnoses. We'll want to start with normal pulp. Here I'll draw the pulp chamber and the root canals that are going to contain healthy pulp tissue. This tooth will be asymptomatic, and when the pulp is tested, it will have a response that is within normal limits. Next, we'll look at reversible pulpitis. I'll draw the pulp chamber and the root canals again, but this time they're going to be filled with a mixture of healthy and inflamed pulpal tissues. So here we have a tooth that is vital and its pulp is capable of healing. When provoked, a tooth like this would lead to a sharp, brief pain, or a delta pain. That's why I'm drawing these little red marks. Next, we'll discuss symptomatic irreversible pulpitis. So here the pulpal tissue is very inflamed and it's past the point where it can heal itself. A tooth like this will lead to C-fiber pain, which is dull, lingering, and spontaneous, which is very different than number 2, which was only provoked pain. Last on this slide, we'll take a look at asymptomatic irreversible pulpitis. The tooth I'll draw here will look a lot like number 3, but the difference is that it will not be causing the patient any pain. This is another vital tooth, but it is again past the point of healing itself. Again here there are no symptoms, but you are likely to see evidence of inflammation in the form of caries or trauma. The fifth diagnosis we'll discuss is pulp necrosis. Again, I'll draw the tooth, but this time the pulp chamber and root canals are filled with dead pulpal tissue. This kind of tooth is usually not symptomatic and doesn't respond to pulp testing. So clinically it might look a lot like asymptomatic irreversible pulpitis, but the key here is that the pulp is no longer vital. The last 2 pulpal diagnoses include previously treated and previously initiated. So previously treated teeth underwent endodontic treatment and were obturated with a root canal filling material called gutta percha. That's the blue stuff. While previously initiated teeth have not yet been filled, so it's not complete. On this slide, I've compiled the sketches and some key information on each of the pulpal diagnoses to give you a quick summary of the topic. I hope this video was helpful. Thank you for watching and have a wonderful day.